Hello, I'm Judson Brandeis, board-certified urologist and Hive 80 member. The following content was created by the Urology Care Foundation. Screening for prostate cancer means testing for a disease even if you have no symptoms. The PSA, or prostate-specific antigen blood test, and digital rectal examination are two tests that are used to screen for prostate cancer. Both are used to detect prostate cancer early. However, these results are not perfect. Abnormal results with either test may be due to benign prostatic enlargement or infection rather than cancer. The two main types of screenings are the PSA antigen blood test, which is one way to screen for prostate cancer. The blood test measures the level of PSA in the blood. PSA is a protein made only by the prostate and prostate cancer. This test can be done in a lab, hospital, or healthcare provider's office. Very little PSA is found in the blood of a man with a healthy prostate. A low PSA is a sign of prostate health. A rapid rise in PSA may be a sign that something is wrong. Prostate cancer is the most serious cause of a high PSA result. Another reason for a high PSA can be benign enlargement of the prostate. Prostatitis, or inflammation of the prostate, can also cause high PSA results. A rise in PSA level does not tell us the type of cancer cells present. The rise tells us that cancer may be present. Talk to your healthcare provider about whether a PSA test was useful for you. If you decide to get tested, be sure to talk about changes in your PSA level with your provider. Make sure to watch our video on the PSA blood test. The digital rectal examination helps your doctor find prostate problems. For this exam, the healthcare provider puts a lubricated gloved finger into the rectum. The man either bends over or lies curled on the side on this table. During this test, the doctor feels for an abnormal shape or thickness of the prostate. The DRE is safe and easy to do, but the DRE cannot by itself detect early cancer. It should be done with a PSA test. Now, in terms of who should get screened, screening is recommended if you're a man between the ages of 55 and 69, if you're African American, or you have a family history of prostate cancer. The PSA test and the digital rectal exam are very important tools. They help to find prostate cancer early, before it spreads, because when it's found early, it can be treated early, which helps stop or slow the spread of cancer. This is likely to help some men live longer. A risk of a PSA test is that it may miss detecting cancer, a false negative, or the test may be false positive, suggesting that something is wrong when you're actually healthy. A false positive result may lead to a biopsy that isn't needed. The test might also detect very slow-growing cancer that will never cause problems if left untreated. Now, in order to detect prostate cancer, you need a tissue sample, and you get a tissue sample from a biopsy. So a biopsy is a type of a minor procedure. For a prostate biopsy, tiny pieces of tissue are removed from the prostate and looked at under the microscope. The pathologist is the doctor who will look carefully at the tissue sample to look for cancer cells. This is the only way to know for sure if you have prostate cancer. The decision to have a biopsy is based on PSA and DRE results. Your doctor will also consider your family history of prostate cancer, ethnicity, biopsy history, and other health factors. I also prefer to use a prostate MRI to detect and localize prostate cancer and to perform an MRI-guided localized prostate biopsy. The prostate biopsy is usually done using an ultrasound probe to look at the prostate gland and guide the biopsy. You may be giving an enema and antibiotics to prevent infection from the biopsy. For the test, you will lie on your side as the probe goes into the rectum. First, your provider takes pictures of the prostate using an ultrasound. Your healthcare provider will note the prostate's gland size, shape, and any abnormalities. He or she will also look for shadows which might signal cancer. Not all prostate cancers can be seen, and not all shadows are cancer. The prostate gland is then numbed or anesthetized with a needle passed through the probe. Then the provider removes very small pieces of your prostate using a biopsy device. The amount of tissue removed depends on the size of the gland, PSA results, and past biopsies. If cancer cells are found, the pathologist will assign a Gleason score, which helps to determine the severity risk of the disease. After a biopsy, you may have blood in your ejaculate, urine, and stool. This should go away within a week. If not, or if you get a fever, contact your doctor. This is Dr. Judson Brandeis, urologist and Hive 80 member. Thank you for your attention. Tune back in to Hive 80 for continual medical and wellness information. Wishing you the best of health.